encourage legislators to not only see our potential, but to also put his name and reputation behind Senator Kaiser's bill. He spoke eloquently in the Senate and has agreed to say a few words here today.
Thank you very much. First of all, thank you, Dr. Bliss and Dr. Bliss, and Norm and all those who invited me to be part of this today. As Dr. Bliss mentioned, I was excited last session, which was my first session actually in the legislature, to work on behalf of Senate Bill 5958, which is kind of the innovative primary health care delivery legislation that's at the core of not only Qliance's model, but the model of many of you around here who are involved in direct practice models. I think we all know it works because it's a return to the patient doctor-driven model of primary care. And it's the model that worked very well for a good number of years. In fact, all of us, I think, grew up under that model until we allowed externalities and non-value-added intermediaries to insert themselves into the process and create this very complex, inefficient system that is healthcare in America today. First of all, I should acknowledge that when I first got involved with this, Gary Locke, I think, kind of gave my name to someone that might be interested in. By the way, have a great lobbyist, Lisa Thatcher here, which I can say I'm speaking on behalf of the legislators. But he actually talked to my legislative assistant, Mark Human, who's here. And as you know, women tend to be decision makers in healthcare consumption. I came back to my office one day after she had talked to Lisa and said, you really need to talk to these folks. This is a great, innovative idea. So I should give her credit. Just so you don't think all her ideas are great, she ran 2 marathons back to back a couple weeks ago. As an employer, as a hospital chair, and now as a policymaker, nothing's proved more challenging than understanding the healthcare conundrum in this country. We spend $2.5 trillion annually on healthcare, which is about 11% of our GDP. Yet we find ourselves not only with 47 million uninsured Americans, we find ourselves with more and more insured folks who every year become less and less satisfied with their interaction with the healthcare system and their healthcare providers. But thanks to the leadership of Governor Greg Warren, who's going to speak in a minute, we've accomplished a lot, I think, in the last several years. Innovative programs in chronic disease management, evidence-based approaches, electronic medical records, just to name a few things that I think in the long run will help improve affordability and quality in healthcare. And we've also worked hard to improve access for small employers, for instance, and also children in Washington State. One thing I'm very proud of is being the prime sponsor of the Cover All Kids bill, which Governor Greg Warren signed last March, which provides not just access, but a medical home, which is very close to what we're talking about here, for another 39,000 uninsured kids in the state. Kids who, by the way, whose only point of entry to the healthcare system before that was the door of the emergency room. But of all these well-intentioned but somewhat unproven steps in healthcare reform that I've been a part of just this last session, it may be that this particular bill, Senate Bill 5958, which promotes the direct fee primary practice model championed by all of you in this room, may turn out to be really a far more significant contribution to improving healthcare delivery in this state and in this country. At least I think it has that potential. Like most of the best ideas around healthcare reform and innovation, it's about medicine, making medicine work for patients. Medical homes, preventive care, focusing on what works instead of what pays, taking out the middleman. And again, this is no small matter. The high cost that we see up to 40%, as Dr. Bliss indicated, impose an unnecessary burden and make healthcare insurance more unaffordable for most Americans. I think direct practice medicine is very elegant in its premise, putting doctors and patients in the center of the healthcare equation while removing costs. And even more compelling, I think, is the high-touch primary care model, which improves the efficacy of preventive care. I think we all understand that to be the real power around this particular model. We've always talked about the efficacy of primary care and touted the wellness model as a way to optimally practice medicine, but we've also understood that the key to this was improving the quality of doctor-patient interaction, both in terms of outcomes and cost, but we really never had a widespread patient access to a model that does that. Something that's not based on procedure-based reimbursement, which tips the balance towards interventional solutions and complexity and forces primary care physicians to take larger and larger patient loads. Qliance does all that in a way that I think is not only admirable in terms of improving quality and affordability, but also maintains access for low-income individuals, which is part of the goal here. Last but not least, I'll just close on this note, it's also a piece of healthcare policy which attempts to improve both quality and cost without adding additional government intervention and regulation, and on top of that, without the requirement of additional state funding. I have to tell you, as a state policy maker, that's like the trifecta. So as long as Dr. Qliance Launch Party and the folks in this room can continue to come up with innovative ideas which do more for less and free up funding for other vital areas of state spending in the state, I think I can speak for Governor Gregoire saying, keep those ideas coming.